off. It's been a goal for Minnesota health officials since April. Today, a win in the COVID-19 battle as the state reaches a daily testing capacity of 20,000 tests. That announcement this afternoon from Governor Tim Walz. Our Barrett Leone is in the studio with more what happened this afternoon. Barrett?
Good evening, Tom. Now that we've reached this milestone, the state's COVID-19 response transitions into COVID-19 management.
Monday was a good day for Minnesota.
This was a goal laid out. We're there. We believe we have the capacity to maintain this for the long haul.
As the state announced a breakthrough in COVID-19 testing, a daily capacity of 20,000 tests.
We're very proud of Minnesota for reaching this milestone today.
Rochester's own Mayo Clinic and the University of Minnesota playing a large role in that feat.
This means we can test who we need to, where we need to, when we need to help people make decisions to protect themselves and their loved ones and their communities. That we can identify hotspots as they're occurring and quickly target our efforts to slow the spread, to see how we're doing statewide and where we need to change course.
The U of M transforming research labs into testing facilities and advancing research and testing strategies.
It hasn't been the University of Minnesota and Mayo Clinic alone. Every health system in the state has stepped up.
While the clinic has delivered supplies and advanced testing effectiveness, providing more than 280,000 out of the more than 500,000 tests conducted in the state to date.
More important than the numbers is that the people that need the testing feel that they can confidently get the testing.
But the state and the country isn't out of the woods yet.
We're still deeply into that winter. We are not out of this as the nation is seeing it. We're going to have to learn to live with and manage COVID-19 for quite some time. So there was no quick fix. We certainly want to see the therapeutics improve as they have. We want to see us work towards that vaccine. But that's work down the line. In the here and now, we have to be able to respond.
State health officials say despite this testing milestone, we can still expect to see peaks and valleys in COVID-19 cases. Like it's been previously said, Minnesotans are encouraged to take a test if they feel sick or they feel they have been exposed to the virus. Another thing to note, testing capacity does vary from site to site. The Minnesota Department of Health does have a layout for state testing facilities and requirements for each facility on its website. We'll have a link to that on KETTC.com. Reporting live in the studio, Barrett Leone, KETTC News.